Hello, my name is Jacqueline Gibson, and today we'll be exploring my journey as a professional counselor. A professional counselor is an individual with a master's or level degree that specialized training in addressing mental health, behavioral, and emotional issues, according to ACA, with the three most important skills being flexibility, empathy, and advocacy. Personally, my experience with counseling goes back pretty far. My mother is actually a clinical psychologist who graduated from the Chicago School at the Chicago School campus in Chicago. I remember as a little girl going with my mother when I was about 12 years old to the library when she was writing her dissertation. While I don't fully remember all of this, she reports that I would pick out different books off the shelves and ask her several questions about psychology, starting at a very young age. Due to this, therapy was always a welcome topic in our home. Growing up, I have memories of my friends coming over and sitting down with my mother to talk about problems because she gave the best advice. As I got older, I began to become that friend for others and realized that I had a true passion for helping others. For me personally, counseling has also changed my life. My whole family began seeing a counselor when my father lost his job, and to this day, I believe that counseling kept our family together. I personally have a history of trauma as well as a past addiction to alcohol, and rehabilitation, group counseling, and individual therapy has saved my life. This may sound cheesy, but my ultimate goal is to help others in the way that I've been helped. After graduation from Purdue, I've worked as a case manager and a behavioral health specialist. This experience I gained invaluable knowledge about different treatment modalities, crisis intervention, and effective patient care. This work was very meaningful to me as I was able to help individuals get into the appropriate treatments they needed, help them gain employment, establish relationships with family, etc. However, I wanted to be a part of these individuals' healing process. Therefore, my goal as a counselor is to work with adults suffering from a wide range array of mental health disorders, including trauma work. I am also currently collecting hours for my LAC so I can work directly with substance use and co-occurring substance use. According to Gibson in 2019, counselor identity develops through a process of ongoing self-reflection. With this in mind, I believe that learning is an ongoing process that I have committed to for the rest of my counseling career. According to PASFA in 2018, ethical decision-making is the practical process through which clinicians or counselors base their actions, behaviors, and choices on informed, sound judgment. It draws on the values, principles, and standards of behavior that inform professional practice. I have learned to use the ACA Code of Ethics and the Practitioner's Guide to Ethical Decision-Making by Forrester, Miller, and Davis to aid in my ethical decision-making process. For example, during the beginning of internship 2, I was assigned a new client. During our initial intake session, which was led by my supervisor and myself, he disclosed that he got out of an M1 hold 2 days ago following a suicide attempt where he slit his wrist. This client was referred to treatment following pleading guilty to motor vehicle theft, and his therapy was court mandated. He reported a diagnosis of bipolar disorder and reported that he was prescribed Lamictal and other medications which he could not remember, and reported that he does not take his medications consistently. Several ethical codes came into play. First, Code A2E is important to note as it outlines that counselors address the necessary limitations to confidentiality when engaging with clients who have been referred for counseling services. For instance, I told my client that I will be reporting the date and time of our sessions attended as well as the treatment modalities utilized during sessions to report to his PO. Secondly, B1D, explanation of limitations. At initiation and throughout the counseling process, counselors inform clients of the limitations of confidentiality and seek to identify situations in which confidentiality must be breached. At the commencement of the session, I informed my client about the duty to warn, meaning that I have a legal and ethical obligation to break confidentiality when a patient poses a serious threat of harm to themselves or others. This includes when a patient expresses suicidal ideation. Lastly, in this situation, an important ethical code was A11A, competence within termination and referral. If counselors lack the competence to be a professional assistant to clients, they avoid entering a counseling relationship. Following the initial session, my supervisor and I consulted regarding this client. We decided that with consistent weekly supervision, I would be able to see this client weekly. However, I received a call 2 days after the initial session stating that he was entered into another M1 hold for a second suicide attempt, as well as relapse. Me and my supervisor consulted again. At my current site, medication management is not offered. I was honest with myself in this situation and stated that I felt this case was out of my comfort level as an intern. Together, me and my supervisor decided that a higher level of care with medication management would be the best route of care for this client. In order to do this effectively, I met with the client and explained these reasonings. I then provided the client with an extensive list of referrals for more inclusive care facilities that provide inpatient care as well as intensive outpatient, group therapy, medication management, and options that work with his Medicaid insurance. My ethical decision-making was guided by the Forrester, Miller, and Davis model, Practitioner's Guide to Ethical Decision-Making. In this situation, I was particularly influenced by the principles of beneficence and non-maleficence. Beneficence encouraged me to act in the best interest of the client, while non-maleficence reminded me of the importance of avoiding harm. Recognizing my current limitations as an intern, I made the difficult but ethically sound decision to acknowledge that I am not yet equipped to work with clients in such a high-risk state. I believe that referring such cases to a more experienced professional ensures the client receives the most appropriate care and upholds ethical standards. Next, we'll talk about addressing culture and biases. I personally identify as a white Jewish American female, and this has shaped my understanding of the world around me. However, my father and half-siblings are Christian, which has allowed me to be involved in different cultural spaces, allowing me to see different perspectives throughout my lifetime. Throughout this counseling program, I've learned that culture is not just something external, it's deeply intertwined with my own identity, values, and perceptions. I have become more aware of how my own cultural background shapes the way I interpret clients' experiences, communicate, and even define concepts like success and money. At times, I did realize I was unconsciously centering my own cultural norms, which underscored the importance of cultural humility rather than just being culturally competent. I've learned that being a cultural responsive counselor isn't about knowing every cultural fact, it's about being open, curious, and respectful to the client's worldview, especially when it differs from mine. I have also been able to confront some of my own biases through group work, supervision, and work with diverse populations. I recognized areas I had assumptions I needed to challenge. For example, my site does animal cruelty evaluations. I didn't even realize that I went into these evaluations with preconceived notion that these people were definitely going to be violent, they'd probably be mean and not very friendly to be around. However, through performing these evaluations, I realized that many of these people are not mean, they're not violent, but have very specific underlying issues or specific cultural differences that affects the way they treat and view animals. This awareness is something I'll carry forward, knowing that cultural self-reflection is an ongoing process, not a one-time insight. Ultimately, I've come to appreciate how critical culture is in building genuine therapeutic relationships and how important it is to meet clients where they are, honoring their lived experiences without imposing my own lens. Over the course of my counseling program, my personal theory of counseling has developed into somewhat of an integrative approach that is primarily person-centered while also drawing from cognitive behavioral therapy and dialectical behavioral therapy. This combination reflects my belief in the importance of creating a warm, empathetic, and accepting therapeutic environment, while also equipping clients with practical tools to navigate their thoughts, emotions, and behaviors. As mentioned, at the heart of my theory is person-centered, inspired by Carl Rogers' emphasis on unconditional positive regard, empathy, and congruence. I believe that when clients feel genuinely heard and accepted without judgment, they are more likely to explore their internal world and move towards personal growth. At my internship site, I currently work with clients under felony supervision, meaning that about 90% or more of my clients are court-ordered. Oftentimes, these clients are very guarded, untrusting, and are somewhat willful when attending sessions. For example, most of my clients are on sobriety monitoring, and I have had a few clients come back positive for drugs and alcohol. I have found that these clients are often scared to tell me for fear of the consequences. However, when this information comes to light, I use unconditional positive regard with my clients. I may say something like, "You are human and you made a mistake. We are going to get through this together by figuring out what is the best course of action for you." By showing my clients that they are valued, heard, and my feelings about them have not changed, my clients have opened up and we are able to solve problems and make solutions together. As I gain more clinical experience through leading treatment groups, I recognize the value of integrating structure and coping skills, especially for clients struggling with anxiety, depression, or substance abuse. This is where CBT and DBT became important additions to my framework. CBT has helped me guide clients in identifying and challenging distorted thinking patterns, while DBT has provided a framework for supporting clients in developing distress tolerance, emotional regulation, and interpersonal effectiveness. My theory has evolved from a humanistic lens to one that balances validation with change, which is a central dialect in DBT. I've learned that some clients benefit more from empathy and active listening, while others need structured interventions like skill building, which can be provided through CBT and DBT. Being flexible and responsive to client needs while remaining grounded in a person-centered philosophy allows me to meet my clients where they are. Ultimately, my approach is grounded in the belief that the therapeutic relationship is the foundation for change, and collaboratively integrating coping skills tailored to the individual leads to more effective and compassionate care. Some of the most impactful moments in my counseling program occurred during my practicum and internship experiences, particularly when I began working with clients independently under supervision. One moment that stands out was when I worked with a client who had experienced significant trauma and initially struggled extremely to open up. Through introducing the use of music the client enjoys, the client was able to connect his emotions to different lyrics of the songs. I'm not sure what it was about at this moment, but my confidence in my abilities to pick up appropriate treatment activities and my ability to engage clients drew dramatically from this experience. Over time, through consistent application of person-centered, I was able to build mastery, build strong therapeutic alliances. That experience deepened my understanding of the power of empathy, active listening, and the importance of patience and pacing in the therapeutic process. Adjusting the speed, emotional intensity, and tone of a session to match the client's needs and capacity for processing information and emotions is essential. These aha moments, I like to call them, remind me of why I'm in this field, to aid the growth and the self-recovery of others. It is important to celebrate even the small wins, such as a client using a coping skill or completing a short-term goal that they set out for. Another pivotal moment was receiving feedback during the supervision sessions. My supervisor challenged me to explore my own countertransference and help me recognize subtle nonverbal cues I was missing, as well as weekly discussions on ethical dilemmas. These discussions pushed me to become more self-aware, intentional in my interventions, and confident in using evidence-based modalities like CBT and DBT. These experiences have advanced my clinical skills by helping me move beyond textbook knowledge to a deeper, more intuitive understanding of the client's needs, cultural context, and the therapeutic relationship. One obstacle in completing my program was managing imposter syndrome and performance during the early stages of direct work, and still to this day. I often question whether I help approaching clients effectively or am using the right approach. This self-doubt combined with the emotional weight of client stories was challenging. I overcame this by leaning into supervision, engaging in peer consultation through my own therapy, and reminding myself that growth in counseling is a process and no one is perfect. Another big obstacle in completing my program was managing financial burnout, financial strain, and finding balance between school, clinical work, and my personal life. The emotional demands of counseling, combined with a heavy academic load and financial pressure, often left me feeling overwhelmed and stretched thin. There were a few times where I felt like I couldn't keep going. What helped me push through was developing better time management, setting clearer boundaries, and prioritizing self-care, and really truly understanding the value of it. I also learned throughout my program that I can lean on many wonderful people, such as my support system of peers, mentors, and faculty, which have made a tremendous difference. These challenges ultimately strengthened my resilience and reminded me that being part of an effective counselor is learning how to care for yourself while also caring for others. Now I will be discussing needs in the Denver community. According to Tumor 2024, Colorado experienced a 39% increase of homelessness from 2022 to 2023, with over 14,000 individuals reported unhoused in a single point in time count. Mental health challenges are deeply intertwined with homelessness. The Colorado Coalition for the Homeless reports that 71% of people experiencing homelessness are also dealing with mental illness or PTSD. Daily functioning, including maintaining relationships, budgeting, and organizing tasks, becomes significantly harder with untreated mental health conditions, compounded by stigma, systemic racism, and barriers to psychiatric and behavioral treatment. Many individuals remain disconnected from the support they need. My solution to this would be weekly pro bono counseling services at a local church or community center in Denver, open to individuals experiencing homelessness. Services will be trauma-informed, following SAMHSA's principles of safety, trustworthiness, peer support, collaboration, empowerment, and cultural humility. It will be offered in both individual and group formats, allowing clients to engage in whichever way they feel the most comfortable. The goals and outcomes of this program will be to increase daily functioning through skill building, support employment readiness via counseling, and connecting individuals with medical and psychiatric services through Medicaid enrollment, and also reducing PTSD symptoms and improving the overall quality of life through consistent, evidence-based therapeutic care. Why I chose trauma-informed care is because homelessness and PTSD are bidirectionally linked. Trauma often precedes homelessness, and the instability and danger of living unsheltered can also worsen trauma. Therefore, a trauma-informed approach ensures care is delivered in a way that avoids re-traumatization and builds trust within a vulnerable population. That is why I would like to do this in my community. Lastly, here are my references. Thank you so much for listening to me, and thank you so much for this wonderful program.